Good afternoon and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, Marketing Specialist, and I'll be your moderator. We are excited to welcome Mark DeTorre as our speaker tonight, as he will share 4 keys to successfully driving patient demand in 2021. Mark is the Chief Operating Officer for MSG Minnesota and has over 25 years of experience in dental marketing. Before we get started, we have a few reminders for you. At any point during tonight's webinar, we do encourage your participation through the chat and Q&A features. Please type any questions you might have into the Q&A section of your control panel, and we will answer them live at the end of the presentation. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. And this webinar is sponsored by Henry Schein's Dental Business Institute, as well as Henry Schein Practice Growth. Mark, thanks for joining us tonight. We're looking forward to your presentation.
Great. Thank you very much, Adam. Thanks for having us. Thank you, everyone, for taking the time this afternoon or this evening, depending on what part of the country you're in. We're excited to talk about the 4 keys to successfully marketing and driving patient demand in your practice. As we get started, and we know that the world has changed and continues to change over the last 12 months, the first thing that we'd like to say is we hope that your family and you and your staff are doing well during this time. It's been challenging for all of us, and we hope that all is well as we hopefully see a light at the end of the tunnel with COVID-19. And part of what we'll talk about tonight in terms of how the world has changed is the implications of COVID, but other implications as well. So the first item, and this all leads up to the challenge associated with driving patient demand, but we have to take a step back and say, how is the world changing? And one of the studies that was done by the Health Policy Institute is anticipating a 20% decline in dental care spending in 2021. And it also did a survey with private practices and found that while almost 100% of practices are now open, only about 40% of them are seeing business as usual in terms of patient volume. And there could be many reasons why that's happening, but it's one of the ways that the world is changing and one of the factors that we have to take into consideration as we start to develop ways to drive patient demand. So it's one piece. It's a piece which is business as usual is maybe not business as usual any longer. A second piece of how the world is changing, in the most recent census, it shows that about 10% of all households moved in 2019. So if you think about that, if your practice has 2,000 active patients, you start out the year, or potentially over the course of the year, down 200 patients just from the fact that people are moving in and out of your area. And the second key issue, and as I'm a baby boomer, I kind of feel upset about this fact now, is that consumers that are aged 24 to 39 now make up the largest segment, or a larger segment, than baby boomers. And that has a real implication for how we think about our practice or how we think about a small business. These consumers are rarely without their smartphones. They've been raised on the Amazon Prime world. They consume social media in huge amounts, and their expectations and requirements are different. And so we have to consider that and weigh that in how we're evaluating how to drive patient demand. The other thing, over the course of this webinar, I'm going to intertwine the comment of dental practice and small business, because in many cases, there are a lot of similarities between the challenges of any small business and that of a dental practice. So there will be a couple of situations where I intertwine the two together. The next item that is a factor, and it's the elephant in the middle of the room that we're all completely aware of, is COVID-19. And a large insurance company recently did a study that came out, and as you can see some of these numbers, but it's challenging in terms of consumers' apprehension about the dental office. And in fact, only 4 in 10 respondents to this survey felt that their dentist knew how to prevent the spread of COVID. And so communication and how we communicate and the way that we communicate with existing patients as well as driving new patients is part of the critical factor that we have to think about in driving patient demand. So as the world continues to change, there's 2 quotes that we found that really relate to how we think about the turbulence going on in the marketplace and how we have to manage it. And one is from Peter Drucker that said the dangers in times of turbulence is not the turbulence itself, but it's that we're acting with yesterday's logic. And as small business owners and as dentists, we have to take a step back and ask ourselves, are we living in a world where we can no longer act on yesterday's logic? And it's very difficult to change. And the second quote that we like is that it's hard to change because people tend to overestimate the value of what they have and underestimate the value of what may be gained by giving it up. We don't want to change. The challenges associated with change, especially in small businesses, dental offices, when we're trying to manage everything going on in the office, is very difficult to do. But I would say over the course of the next 25 or 30 minutes, if you keep these 2 items in the back of your mind in terms of how we have to think about our patients, our customers, and how we have to think differently moving forward. And so one of the key questions to ask yourself, and what we would challenge the thinking is how you think about your practice is critical for the long-term success. And what are those items that you have to think about? The first thing is, what does my practice stand for? In marketing terms, some would say, what's your brand proposition? What does your brand stand for? But as a dental office and as a small business, what does your practice stand for? And we'll talk a little bit about that as we go through. The second critical question that you have to think about is, who do we serve and how do we serve them? Who are our present patients? What is the service that we're providing them, and how do we do that? The third thing, which goes to the first item, which is what does my practice stand for, is are we delivering a unique value proposition versus others in the area? And who are the others in the area? And this is a very difficult thing for many dental offices to do, to think about the fact that they have competitors in the area. And is their unique value proposition different than their neighbor within their geographical footprint? So as we think about these, what is it that we stand for? Who do we serve? And what is our unique value proposition? The other thing is, are we communicating with our existing patients and future patients in a consistent manner and a way that's conducive to their needs? Back to that thinking about, are we doing things the way that we've always done things? And thinking about the demographics of the world today. Is our way of communication and our approach to communication and our approach to our service conducive to the needs of both our existing and future patients? Are we attracting new patients that understand our value proposition? Have we clearly defined what our value proposition is? And do they understand what that value proposition is? And the last item is, how do we define success? So when you think about all of these things together and you ask these questions in terms of the critical questions for long-term success, believe it or not, you're thinking about how to market your practice. You're thinking about what it is that you stand for and how you're going to uniquely separate yourself from others in the marketplace so that patients consumers consider your business over someone else's. So marketing tends to be a challenging word that many dental offices don't like to use. And I can tell you that probably in the last month, we've had conversations with practices, and the very first thing they say is, I don't need marketing. My practice is growing on word of mouth. Our response to that is, are you using yesterday's logic, first of all? And are you thinking about it properly in terms of word of mouth, where word of mouth is good, but do you expand that to reputation management and referrals? And so all of those go into marketing, and we'll talk about that. But the challenge with the word marketing is that many dental offices and many people in general think that marketing is a bad word. It means selling. And we're in the business of healthcare and dentistry, and we don't sell dentistry. But I would challenge you to think of marketing not as selling and as a challenging word, but to think of marketing as a business process, an item and a process that you can use within your business to help you move forward to accomplish the vision and the goals that you have for your business. And so how is marketing a business process? That gets to the 4 keys to successfully marketing your practice, driving patient demand. And so we're going to go through those 4 keys. The first, you have to have a plan. It's critical. The second is a commitment of resources to the plan. The third is consistent implementation. And the fourth is setting goals and measurements. These are the 4 items that we will look at over the course of this webinar to talk about what makes a good plan. What do we mean by commitment of resources? What is consistent implementation? And how do we set goals and measurement? These 4 items are critical to the success of your marketing effort in driving new patient demand. Let's start with the first one, developing a plan, a roadmap. I love this quote from Lewis Carroll: if you don't know where you're going, any road will get you there. I've had 4 conversations this week alone talking with practices, and the very first question that I ask is, do you have a plan? And the answer in most cases is no, we don't have a plan, or they have a general plan. It's not written down. There aren't many details to the plan. And so the question that you have to ask yourself as a business owner, as someone that's trying to move your practice forward, if you don't have a plan, you're at a crossroad, and how do you get to where you want to be? I've worked with an accountant for many years, and years ago we were working with a small business, a dental office, and his comment was, the challenge with small business owners is that they're too busy working in their business to spend time working on their business. And developing a plan, a roadmap for your business, a marketing plan, is really spending time working on your business, not working in your business. And that's a very difficult challenge for many practices that are busy working in their practice. So what is it that goes into a good plan, a good roadmap? The first one is assessment. The first part of assessment is self-assessment, an assessment of your practice. Back to that point that we made earlier. What is your value proposition? What is it that you deliver to your customers, to your patients, and to potentially new patients? Have you written it down? Is it solidified? And does it define who you are as a practice? So you have to look at that and assess, what is it that you want to be? What is it that you stand for? The second thing in the assessment is you have to assess your existing patient base. What does your patient base look like? Not only how many are there, but what is the age breakdown? What is the activity level in terms of how often they visit active patients versus non-active patients? New patient growth. It's all about sitting down and assessing, and as part of your plan, outlining what your practice looks like. And the third piece of that is, what are the present activities that you're doing in terms of messaging and all the activities within your practice, and what results are you getting? Are you looking at the results and comparing them against your present activities? So the first part is that self-assessment. How are you assessing your existing practice? The second key piece to that roadmap and that assessment is understanding the market around you. Who lives in my area and what is important to them? We worked with a practice a few years ago that was very driven to increase their implant business. The challenge is that when we looked at the market that surrounded the practice, the likelihood that this practice was going to be able to drive implant business was relatively low. So as you start to develop a roadmap, you have to not only understand what your value proposition is, what your practice is, but you have to understand the market around you, the footprint that you service. And the last thing, which is very difficult for many small businesses and specifically dental offices to do, is to assess the competition in their area. It's critical to know, who are you competing against? Because if one of your goals is to drive new patients, it's very important to know who is around you and what is their value proposition, because they're competing for the same patients that you're competing for. And I don't want to make it sound different than it is, but in the case, let's take a restaurant. When a restaurant builds in an area, they need to understand how many other restaurants are in the area, what is their value proposition, and who lives in the area. Healthcare is a different scenario, but these three factors influence consumers and have an impact on the ability of you to develop an appropriate plan, because consumers, even if they are consuming healthcare, they are acting like consumers, and you need to understand these three variables. So the first part of a good plan in developing a roadmap is self-assessment in this assessment process. The second is developing strong goals and objectives. And as you can see by this chart, goals have to be specific and measurable and achievable and realistic and timely. We were talking to a practice this week, and we asked, what are your overall goals? And most common response is, I want to grow my practice. I want to increase revenue. They're very good, but they're general. They're not tangible. They're not specific to what you're trying to accomplish. So goals and objectives have to be tangible, measurable, and realistic. And those goals have to take into account evaluating patient visits, procedures. Are you defining, do I want to grow my aligner business? And the patients that I treat for clear aligners. And more specifically, last year we did 6 aligner cases, and this year we want to do 16 aligner cases. Goals have to be tangible and measurable. And you have to think about those goals relative to what are your new patient goals versus increasing services amongst existing patients. And the last is the implications of COVID in general conversation and communications with patients. So not only do you have specific goals, but what are your intangible communication goals in terms of how you want to communicate with patients moving forward? So, setting goals and objectives. The next component to developing and building the proper roadmap is two components: building the tactical activities and a budget. What are those tactical activities? They can be a wide range of activities. They could be digital activities, traditional activities. Are those tactics with existing patients or new patients? Early on, I said marketing is a bad word because many times marketing is closely connected to selling. And we hear often that dental practices and dentists in general say, I'm in the healthcare profession. I don't want to sell dentistry. I want to deliver what my patients ask me for. And that makes a lot of sense. So then what's important is to drive patient interest. Make them aware of what you do so they ask you about things rather than requesting things. And so what tactical activities are you going to do to let patients know what you do and how you do it? And those tactics have to be tied to those clear objectives that you've set out in the plan. And they need to be detailed out and coordinated in a way that ties also then to a budget. You have to decide, what are you going to spend? What are you going to spend in all the different components that tie to those tactical activities? It's a critical part of a plan and a roadmap to get you where you want to go. So after the plan, after defining the roadmap, who it is you want to be, where is it that we're going, what are the tactics that we're going to do, and it's built out in a plan. And it can be simple, it can be more complicated, but it's documented in terms of what you're trying to accomplish. The second most important thing is a commitment and a dedication to the implementation of the plan. You have to be committed to it. You have to own the plan. So many times we work with practices that say, okay, let's get started. And then the dentist and or the staff are not engaged in the process. Everyone has to be engaged. They have to be committed to allocating the resources required, whether it's dollar resources, whether it's external resources, or whether it's internal resources. If there's not a commitment, a buy-in from everyone in the staff and the team, the chance of success of your plan is significantly lower. And so as you build that plan, you have to realistically assess, do we have the resources to do this internally, or are we committed to external resources to help us do it, or a combination of both? But whatever the approach is, you have to be committed to implementing the plan. Otherwise, it won't work. So the third piece, implementation. It's great to have a plan. It's great to be committed to the plan. But one of the most important parts is then actual implementation of the plan. Attention to detail. If you built your tactics and your calendar and everything in such a way that you can implement those details, it's essential that there's clear roles and responsibilities for the implementation and that they're all coordinated together. So for example, if one of the goals is to increase existing patient understanding and request for information about clear aligners, if you do an email campaign to existing patients, and if you're simultaneously doing a social media campaign, the question then becomes, are the roles and responsibilities of the staff to understand that that's going on and to participate in that as patients come in so that it's all coordinated and it's consistent with all of the details required to implement the plan. And it's not only outlining the clear roles and responsibilities, it's consistency. So many practices that we work with get started. They may build a nice plan and they get started, but they get busy working in their practice and they stop. And then they start again, and then they stop, and then they start again. The critical portion of proper growth in practice, driving patient demand, is implementing in a consistent, ongoing way. The fourth is measurement. And of all of the four, I would say in most cases, the fourth is probably the most difficult for many practices because they're not used to developing and creating measurements for how they do from a marketing perspective. There's many measurements on staff productivity and all of the internal workings of the dental office, but measurements such as new patient flow by month, looking at new patient flow by source of activity, referrals, or other means that are tactical things that are being done. Very rarely are practices utilizing their practice management software and other tools to set up the proper measurement against those goals. So you have to, as you build that plan and you develop that commitment to that plan and you start to do implementation, it's critical that you define what are the measurements of success. When we're done, how will we look back on this and say we either succeeded in what we were trying to accomplish or we did not succeed in terms of defining those measurements? And you have to connect those measurements to those goals and objectives in the plan. And you have to decide where staff is involved in those measurements, because let's take new product or a new patient flow is many times when a patient comes in, you need to ask them, and do the staff ask the proper questions to determine which activities had the biggest impact in driving the patient to ask questions. And so staff involvement is a critical piece. Goals and measurements, as I talked about, utilize practice management software. Here's just an example. Very few practices that we have worked with track new patient numbers by the type of new patient in terms of where they came from in the activities. So if you start out with a plan that says, here are our goals and here are our objectives, and one might be new patient growth, it's critical that you're measuring and looking at where those new patients are coming from. And are you using your practice management software, or are there dashboards and reporting tools that can be used to help you develop those? And so, in summary, the four keys: a plan, building that plan, developing that plan with the tactics and the self-assessment of who you are, what you're trying to accomplish, is critical as the beginning point in this roadmap. Commitment of resources, either internal resources or external resources, or a combination of both, to help you commit the resources to implement the plan. The third is implementation. Putting yourself to and allowing yourself to work on your practice, not in your practice, and allowing staff or dedicated resources to do the implementation that's necessary. And then measurement that is tied directly to that plan, directly to those tactical implementation pieces that you're doing. Thank you. And Adam, I'll turn it back over to you for questions.
Great, thank you. We've got lots of time for questions, so if anyone has any, feel free to drop them in the Q&A or chat. We've got one so far, and that is, can you please explain how a specialty practice such as an oral surgeon's office, who might not have recurring patients, should go about their marketing versus a practice that does have recurring patients?
Oh, that's a great question. I'm going to go back up to a slide here in terms of that self-assessment and that roadmap. In the case of a specialty, you're not thinking about potentially your competitors in your market. You're thinking about now who is your potential customer, and that might be local GPs in your market. So within your market, who are GPs that you want to develop relationships with? Who are other specialists in your area that might have relationship with GPs in your area? So you have to slightly think about that assessment a little bit differently than you would as a general practice.
Great. We've got another comment here that says, I have some problems with implementation. What would you suggest?
Oh, that's a great question. The first question I would ask in terms of implementation goes back to the first is, have you clearly defined everything that you want to do? If you clearly defined the tactics, then the second question is, have you allocated the resources? This implementation challenge most of the time comes from expecting existing staff members who may or may not have the capabilities to do the job you're asking them to do, but you've allocated to them. For example, many times practices do implementation of social media by someone in the practice that likes to do social media or that has an inclination to do it or has been assigned it. And implementation becomes a problem in that way because people get pulled back into their normal roles in the practice. So it's critical as you build the plan to sit down with the staff and say, I am committed to this. This is time allocation that must be done. Get buy-in from the staff to implement the plan. If you still have problems, you might consider looking outside the organization to get someone to help you do the implementation. Because in many cases, it gets back to this working in the practice and the commitment of resources. It's very difficult to do that. And so implementation may have to be done by asking someone outside of the practice to help you do that.
Great. We're getting some great questions now. In your experience, what gets better results, implementing tasks in-house within the practice or outsourcing to an outside company?
Oh, that's another really good question. I would say that I'm going to answer it kind of two ways. If you do all four of these key items, then you can implement within your practice very well. There are a lot of practices that can do all of this very well on their own. They've committed the resources, they're engaged in the process, they've built a good plan, and maybe they had someone help them build the plan, but they're implementing it, but they're following these four. If you follow these four, you can do it internally. The challenge is many practices have a hard time doing all four of these, and so therefore it becomes difficult. And if you're not willing to be engaged and commit to approaching it with these 4 key points, then those practices are better served by looking to someone outside that can assist in pieces or potentially do all of it. You can mix and match based on where you want to allocate the resources and where you can do it. But if you do all 4, you can do a very good job internally, but it's a challenge for many practices to do all 4.
So keeping with outsourcing, in your opinion, is it better to outsource to quote unquote a one-stop shop that'll do everything for you, or is it better to outsource piece by piece?
It's another very good question. My personal opinion, I tend to like to go with a one-stop shop for one reason, is that consistency and coordination and ownership resides in one place. It's much easier to work with a team that's a one-stop shop that can do everything and you can hold accountable, that you can develop these tactics, develop the reporting associated with it, and so that it's all coordinated in a proper way. Many times when you pick and choose pieces, they're very good at one thing, but it's not cohesively working together to have the biggest impact on either driving new patients or properly communicating with existing patients.
I am purchasing a small practice that has an existing patient pool, but that's on the decline. Where should I start in terms of dealing with marketing? Should I consider hiring a consultant?
Well, I'm going to go back up to the very first one, which is this assessment process right here. If you're buying a new practice, you really need to do a strong assessment. Assess the existing practice, assess the market around the area, assess the competitors so that you can develop a strong plan for what you want to do with the practice that you're purchasing. I would recommend, in that case, hiring someone that can help you do an assessment. A third party that's objectively going to look at the practice that you're buying, the value proposition, the demographic area, and what it looks like in that area, and clearly assessing the competitors to provide you with an assessment in the area that gives you kind of a fresh framework for how you can think about moving forward. And they can build you that roadmap, and then you can make a determination from there where you go, how you implement the plan. But I think without a lot of detail, but just as an answer to a general question, it's a good idea to have someone do a pretty thorough assessment, probably the same way that you did a pretty thorough internal assessment of the financials and the patient base. You probably want to do that assessment to build the proper plan moving forward.
And going back to the one-stop shop, can you give a good example of who a one-stop shop would be?
It's a good question. Come back to that one. So you did stump me on that one. Let me think about that one. We'll come back.
Sounds good. What % of revenue do you recommend allocating on marketing for a smaller size practice that's trying to expand?
Oh, the rule of thumb in any small business is 1 to 2% of revenue. So let's say, to do the easy math, $1 million is $10,000. But think about it. When you break that $10,000 down, it's everything. What are you spending to house your website? What are you spending for SEO? You can break every single component down to take a look at where all those dollars are going and how efficiently those dollars are being spent. But a good rule of thumb is 1 to 2% at a minimum. And, some people spend significantly higher than that, but that's really a good place to start.
All right. Kind of a general question here, but how does Henry Schein practice growth fit into this overall equation?
Oh, I like that question. That one I can answer. It's not a stumper. The practice growth program is really a couple of things, but the first thing that it is a way to help the practice go through this process. And what do I mean by that? What I mean by that is we have an assessment process. We help you do a market assessment, and we build a marketing plan for you. And then you have the ability to take that marketing plan and implement that plan on your own. Or we can help you implement pieces of the plan. And so the practice growth process is helping you go through these 4 key steps to implementing a plan and helping you develop that engagement and those skills to make a determination of how you're going to go about it and what tools you're going to use to accomplish that task.
Excellent. And if someone wanted to get in touch with Henry Schein Practice Growth, how would they go about doing that?
The best way to do it is to go to the Henry Schein website in the practice services area of the site, and practice growth is there. You can easily fill out a form and request a free consultation with the date and time. The other approach is you can contact your Henry Schein field sales consultant and request assistance, and they'll get in touch with us.
Great, thank you. And we've got a comment here for a one-stop shop. Someone says, we use Sesame Communications, a marketing company that specifically specializes in dental and is a great one-stop shop.
Yes, and I'll answer the question in a different term, in terms of the question becomes, do you want a one-stop shop relative to technology, or do you want a one-stop shop in terms of implementation of that technology? From a personal perspective, I think that the Henry Schein One tool set of technology, that's a one-stop shop in terms of across the board, being able to connect and do everything from a technology standpoint, I think is probably second to none. But that's from a technological platform perspective. And then from an implementation standpoint, I don't have an answer for you. I think there's probably many people that can then implement, but I think from a technology standpoint, I would say Henry Schein One tool set is, I think, the most comprehensive one-stop shop.
I have one more. Does Henry Schein One offer SEO? Do you know that?
Yes, they do. And back to the practice growth, we assist practices in implementing the Henry Schein One tools. And so, yes, SEO is part of the tool set that Henry Schein One does offer.
All right, thank you. And for those of you who want the form that Mark suggested, I put that in the chat for everyone to see. Well, Mark, thank you for your time tonight and the great content you shared with us. As a thank you for attending tonight, everyone will receive this recording of the webinar via email sometime in the next week, so keep your eyes out for that. For more Henry Schein webinars, if you're interested, visit henryscheindental.com/webinars for our upcoming schedule. I'd like to thank everyone for joining us tonight, and hopefully we'll see you back here soon.